Welcome back, dear viewers. Now we have our dear guest, Dr. Shahd Shamiri. She's a literature and writing professor. Welcome to our show.
Thank you, Fatemah. Thank you very much for having me on the show.
Thank you very much for being here. We want to start with literature, since you're the expert. How can literature be used as a tool for promoting mental health and well-being?
Well, first of all, when you think of literature, what do you think about? You think of stories, telling stories. Books, poetry, a bit of drama, a bit of conflict, and that reminds me of life. That's what life is all about. Life is actually about a story, and I think all of us are innate storytellers. For example, I came here today, I had to find the place, there was a bit of rain, sarfi setting, it was a complete setting. Anytime you are living your life, you are telling a story. Literature is the same. When we talk about literature, we talk about telling stories and using these stories to understand ourselves. Research shows that actually people who read literature, any type of literature, are more likely to be less stressed. It actually lowers blood pressure.
Wow.
It connects you to your environment. It's used as a way to ground you if you're starting to feel, let's say, a bit anxious, if you're starting to feel a little bit uncomfortable in your surroundings. Read a poem, read a text, a short story. It'll help you feel more grounded. And again, this is research. It's been, I think, since the 1920s, 1930s, psychologists have actually discovered that therapeutic writing and literature is a great way to begin your emotional resilience journey.
That's amazing. Now, are there any specific genres or types of literature that address the mental health issues?
So it depends on what you like to read. So for example, some people will say, I will only read nonfiction. I like self-help. And then you have people who say, I only like poetry. I only like to read classical novels. I like to read thrillers. I like to read crime fiction. Whatever the genre is, we can make it work. And the idea is whatever you're reading can be related to you. For example, if you're looking at a certain text, we start with, can you identify with what you're reading? So the identification process. Are you able to identify with the character? Does the character, let's say, does Juliet from Romeo and Juliet remind you of yourself at any point in life? If so, great, then we begin to talk about that. How are you similar to Juliet and how are you different from her?
So we need to relate to the characters or the text of this book. Yeah.
But it has to be about you. It's always about you as the reader. So I will select something for you or you will select something for you. Depends on the preference. If you tell me I don't like to read tragedies, then great, thank you for that. We actually work with a prescription. So it's called prescriptive bibliotherapy. Biblio meaning books and therapy meaning mental health. So let's say we identify with the character. The second step is catharsis. And have you thought of the term catharsis in general? Catharsis means something that is cathartic. We release emotions, we release negativity. You're able to relate to Juliet, but you're also thinking, thank God I'm not Juliet. Thank God I'm not living in the 16th century where women didn't have many rights and they were really struggling. So you actually become a little bit more grateful for your current position in life. So you've got identification and catharsis. You also get to release a lot of pent-up negativity. You might cry during the reading process. And this is all just to help you work through your own emotions, your own conflict. Finally, we arrive at a sense of universality. And universality here means, again, a connection. I'm not alone. There's a lot of Juliets in the world, there's a lot of Romeos in the world, no matter their culture, their age, but I actually will not feel alone. So what literature has done here, it has helped you move through a sense of loneliness, a sense of maybe perhaps desperation, isolation, and it's made you realize I'm really going to be okay because others have done this before.
Wow, this is amazing. It's like you're describing most of us how we read. And is this like, and I know this is not part of the questions, but when I come to read a story or any book, is this what I do all the time, or are you talking about us actually reading and engaging with the book?
Actually, it's a great question. There are two types of reading. Pleasure reading, and again, if you just pick up a book and you're like, I want to read because everyone else is reading. Or you pick up a book with the intention of healing, with the intention of reflection. I pick up a book because I want to discover more about myself. I want to work, let's say, through my anxiety. I want to work through my depression. So what you're actually doing is you are creating a purpose from this potential text that you picked up. And when you create a purpose, what you're actually doing is you are telling your brain, the neurons in your brain, to make connection, to create connection between the paper, the text that you're reading, and your personal experience. I would say the very first experience of VR would probably be reading. Now we look at virtual reality. As you enter a game, you play a game. Your brain can't tell the difference between reading a text, the story that's taking place, the tragedy that's happening, and reality. You might find yourself crying, right? You read the text, or you might find yourself shutting the book and saying, wow, that was too much for me. I felt that. Your brain can't tell the difference between fiction and reality. And again, these are lots of interesting neuroscience studies. And what we're doing is we're helping you create more connection between the neurons in your brain. So it's like a brain exercise.
Wow. Dr. Shahd, actually, I think we need a whole episode for this. This is amazing, on right?
Neurons, yeah,
now, is this because we imagine what we read?
Yeah.
For example, a field in Wuthering Heights, for example. Even before we see the pictures or the movie, right?
Absolutely.
And we were picturing, the people there, people here, the colors, the scent.
Absolutely.
Is this why our brain cannot differentiate between reality and fiction?
It's definitely the visuals, but it's also emotion. So literature actually cultivates empathy. It cultivates a sense of emotion. So you read something and you feel like it's you. Our brains, it's the same actual region in the brain that connects with empathy and cognition. So anything that you read will feel real. Of course, the visuals help, but also the dialogue, the language.
The attachment.
The attachment that you form with these characters, the attachment that you form maybe even with your life, again, the sense of reflection. If this happens to Catherine in Wuthering Heights, it can happen to me.
Yes.
So there's this sense of also fear, and there's this sense of empathy, all connected. So it has a lot to do with how we relate to the text, not just with visuals, but also dialogue and how these people remind us of ourselves.
Wow. So can you please tell us a practical example of how literature has been utilized in therapeutic settings to support individuals with mental health challenges?
So I think all of us are in some way struggling with mental health or emotional health or even physical health. Studies have shown that the usage of literature, let's say even in prison, can actually be really therapeutic. So getting people to actually read again, to talk about this this period of isolation. You can find lots of characters in literature who have gone through the same thing. Using literature in therapeutic setting can also be related to writing, so not just reading, but also writing. So writing about what you've read, reflecting about what you've read, writing about your life story. So for example, what is my life story? Am I a protagonist or an antagonist? Am I currently the hero in my own story, or am I the villain in my own story? What is the current conflict in my life? So lots of practitioners, lots of therapists, psychotherapists, literature professors, anyone who actually has an interest in literature and mental health can help you with actually working through these really hard emotions to work with. So literature offers you a gateway, a place to begin to explore without tackling the issues in a very confrontational manner. So we work with different styles to approach whatever you might be feeling.
Okay, and so this takes us to the next question. What are the risks, or are there any risks or limitations associated with using literature as a therapeutic intervention? For example, when you just mentioned, am I the hero or the villain in my story? It's amazing because sometimes we would think we are the heroes, but maybe I am the villain, and I have to admit to myself that at some point I am the villain. You know, after all, we're all human beings.
Absolutely.
So what are the risks and limitations?
So once you talk about identification, you're also talking about something that could potentially be triggering for you.
Definitely.
So depending on how ready you are, your I would say your resilience, your ability to confront yourself, to look in the mirror, there will be a sense of identification, let's say maybe with one of the villains in the story, and you might feel a sense of guilt for having, let's say, said something, done something. I would say also, to make sure that you are currently mentally well, I would check that you are, also talking to a therapist at the same time. This is an adjunct treatment, so it doesn't mean it isolates other forms of treatment. You can have both at the same time. Journal writing and expressive writing is a bit different. You can do it on your own. A lot of people keep journals, a lot of people document their everyday life just to trace their moods, just to trace how they might be feeling, and begin to kind of get a hold on things and begin to understand yourself more.
Okay, and so when we talk about therapy and we talk about the mental health professionals, how can they incorporate literature to their self-care practices or treatment plans?
So it depends on if this is something that the therapist is even interested in. A lot of people are interested in expressive writing and bibliotherapy. Not a lot of people do practice it. It really is a preference at the end of the day, not just for the practitioner, but also the client. Some people just don't like to read. If you force them to read, it's going to be a complete failure. So the readiness, like we said, has to be really important, and it has to be really there, of both practitioner and client. I always recommend, just for your everyday life, keeping a journal. I still keep one every day. I document life. I document even the experience of feeling a bit sad or a bit nervous. So I've had a nerve-wracking day. I've had a difficult day, and I kind of ask myself why. So it is a therapeutic process, even in the journal entry itself. Why did I feel so and so? How long did it take me to get over that feeling? When did it start? How can I change it? Okay. So asking, I would say, the questions for yourself really offers you a lot of insight. And it doesn't have to be just with a therapist or with a practitioner. You can start to become your own individual support system by applying the tools that you already have, which is storytelling, stories, and pen.
Wow. And this is what we were talking about before we started this episode, when you were talking about your workshop, Writing to Heal. Can you please tell us more about that?
So Writing to Heal, just from the title, we write for publication, we write for fame, but we should also be writing to heal. So ever since the beginning of time, words have been there to help us heal, to help us reflect. The ancient Greeks and Egyptians used to use libraries as a place to heal the soul. And we can do the same thing today. So Writing to Heal involves asking yourself the difficult questions. Am I actually happy where I am today? What can I do to actually change? What can I do to begin to change the narrative? And when I say narrative, your life narrative. We have a life narrative. It can change, but the only person who can really change that is the person writing it. So you can rewrite your narrative, you can change it. Writing to Heal helps you begin that process, and it's a long process that demands consistent effort, but the rewards are really great.
And is it a group work, or can we do it individually?
So it's both, either as a sense of a group, a community, and community work offers a lot of benefits. You get to also share your work with other people. Sharing your work allows you to foster empathy, but also vulnerability. And we struggle a bit with that, with vulnerability, with revealing our deepest, darkest thoughts. And if you do that in a group setting, you're able to get over that fear, but also realize, again, you're not alone. There's someone else who's probably feeling the exact same way. Individual sessions are available, but that's for people who prefer that sense of safety and security. Both have really great rewards.
Interesting. And what about literary analysis and interpretation? How can they contribute to understanding and addressing mental health issues?
So when we talk about literary analysis, we're not talking about pleasure reading anymore. We're talking about some detective work, trying to find out what this text symbolizes. For example, let's say we talk about a poem called The Road Not Taken by Robert Frost, American poet. It says the road not taken. So what does a road actually symbolize for you?
Okay, so life journey.
Life journey, choices, paths. And he says, two roads diverged in a yellow wood, and I took the one less traveled by. And that has made all the difference. Next step in literary analysis would be, what do the roads symbolize, and does the speaker actually feel proud of his choice to take the road less traveled by? What does the word difference actually signify? Is it a difference that is positive? Is it a difference that is negative in his life? That's literary analysis. Simply put, you look at the words and what do they actually symbolize for our mental health, for our life journey, and for conflict. So we really pick at the words to be able to find multiple interpretations, not just of literature, but of life, and how we can make better, healthier choices, how we can stay, well-rounded individuals. Again, just using poetry or using literature, we can begin to talk about our life choices. Are we in the right place or not?
That's amazing, because I was just going to ask you, I can interpret it in a way that is totally different from what you interpret from anyone else, but we can all go back to the same poet and what it means to us and how it affects our life.
Yeah, so you've just reflected, and the more reflection, the more you're going inwards, the more you're beginning to understand yourself. You're beginning to make the text about you.
Yes.
And that would be called reader response theory. What does the reader actually see in the text is very important.
Wow, thank you very much, Dr. Shahd. We do have a lot of questions, and I think we need a part 2 for this interview.
Absolutely.
Thank you very much for this informative interview.
Thank you, Fatemah, for having me. I appreciate it. Thank you.
Dear viewers, that was Dr. Shahd Shamiri. She's a literature and writing professor. We want to thank her for this amazing interview. And now we have this report about mosques, and we'll be right back, so stay tuned.